Time now for our weekly partnership with Asante. This week, Asante's health expert, Beth Croker, talks with Dr. Kelleher about what Narcan is and why it is important for the public to have it.
Southern Oregon has a high rate of opioid drug overdose, and our Asante emergency department sees 3 or more cases a day. Now the Food and Drug Administration has approved Narcan nasal spray to be sold without a prescription, making it the first naloxone product authorized for use. Dr. Kelleher, what is Narcan, and why is it important for the public to be able to purchase Narcan over the counter?
So Narcan is a medication that can rapidly reverse the effects of opioids and is used to treat opioid overdoses. By making this medication over the counter, it is going to expand access to patients and hopefully reduce the number of overdose deaths. Unfortunately, opioid overdoses occur frequently both locally in our community and across the country. So it is great that people will now have easy access to this life-saving medication.
And how does Narcan work, and how fast is a patient response to it?
So Narcan works by binding to and blocking opioid receptors in the brain, thereby limiting the effect that opioids will have on someone. Opioids can cause people to have decreased level of consciousness and decrease their respiratory drive. Narcan is able to reverse these effects, bringing people that overdose back to life. Patients typically respond to intranasal Narcan spray within 2 to 5 minutes, and it can last for anywhere from 30 to 90 minutes.
Are there any negative side effects using Narcan?
Narcan only works if someone has opioids in their system. If someone does not have opioids in their system, they will not experience any symptoms or side effects from this medication. When Narcan is given to someone who is dependent on opioids, it can cause withdrawal symptoms, including nausea, vomiting, abdominal cramping, anxiety, and restlessness, amongst other symptoms. Since this medication can save someone's life, the benefits of administering it far outweigh the risks and side effects.
And will the cost of Narcan over the counter still be too high for some people?
I think that's really the big unknown with Narcan moving to over the counter. I did see recently that the pharmaceutical company said that the medication will cost less than $50 for 2 doses. I do worry that this price point will be too high for many individuals, which will limit how many people buy it and how many lives can be saved. While some organizations distribute this medication to at-risk people for free, it would still be helpful to have this medication priced at a point where everyone can afford it.
Thank you so much for helping us get the message out on Narcan. For more information, visit health.asante.org.